All right, good morning and thank you for coming in today. I'm Dr. Edward Kammerer. I'm the Chief Medical Officer for Mosaic Health Systems. To clarify today, we're going to do an update on COVID. We'd like to know that, like everybody know, that this incorporates our entire system, so this will be our four main entities regarding St. Joseph as well as Maryville, Albany, and our long-term acute care hospital and all those areas that we service. So when I give you these numbers, this incorporates a several county area, basically northwest Missouri. So today we have 16 patients in the hospital, which is substantially down from approximately mid-January. We would have been up in the almost at 90. So again, this has tailed off tremendously over the last several weeks, and we're grateful for that. Our positivity rate is the number of positive tests that occur in our system from all the tests that we order. And so this is a great indicator of how many people are going to be in the hospital. So today our positivity rate was down at about 8.5%, which is actually the lowest it's been since the first week of October, where we had a couple of days of 8%. And prior to that, it would have been June of last year when we had 8% positivity. So again, we're very grateful. We're seeing a significant decline with regards to hospitalizations as well as our positivity and our testing inside of our communities. So with that being said, we have one patient in the ICU who's on a ventilator, but the rest of the patients are, again, we're seeing definitely less severity with Omicron than what we've had in the past. So we're very hopeful that we can continue this decline. There's a lot of speculation out there right now as to what does this look like in the future. We think that we have certainly, between the vaccination rate as well as the natural immunity that occurs after infection, that we're getting closer to the idea of herd immunity, at least for the time being. So we're hopeful that we're going to see a significant decline. And with that being said, it has really been an amazing run for us. You know, it's great to see some relief for our caregivers, and we're extremely grateful at Mosaic for those caregivers who have stuck with it, who've stayed in the fight with us as we've been. If you think about this, it was March 17th of 2 years ago, that things really shut down. So we've been at this battle for 2 years. And again, we're very grateful for all those caregivers who put forth their time and their effort, their diligence, the things they did, the dedication to stay with us, to stay with our patients, and to help take care of our communities. So Mosaic is eternally grateful to our caregivers for that. Thank you. With that being said, that's kind of a quick update as far as treatment goes. We have no issues with regards to antibody treatments. We have plenty of antibodies. We're in good shape with regards to our remdesivir. So we have no shortage of supplies. We have ventilators, protective equipment. All those things are in excellent state right now. So again, we're really doing well with regards to our current COVID situation. So where do we go from here? Well, our goal is to continue to take care of the patients that need to be cared for. We continue to advocate for all the appropriate measures to try to reduce COVID in our service areas as well as our communities. And we will continue to be vigilant. Really, we would suspect that at some point in time, ultimately, we have another variant that arises. We do think this will be a period of time before it occurs, though. So we're hopeful. We'll take the respite that we have right now. We'll take the break, and we'll be grateful for what we can, the little bit of resilience and time building that we have in order to get better and a little less census. So again, it's been a great month for us as we see the numbers decline. So I'll take questions with that.
On the numbers, I know that there was always the 16 that you give about being treated now, but there's some that have been in the hospital for 21 days or more. How many of those do we have?
Yeah, thank you. So after the number that when we say 16 in the hospital, we're talking about people who are currently in isolation. And these are folks who are still actively infected. After 21 days, they go out of isolation. So these are what we call long-haul patients. These are the long COVID stays. We do have about 20 of those in the hospital still. And those folks can range anywhere from 20 days, again, when they come out of isolation at 21 days, I guess it is, all the way up to 60 or 70 days of hospitalization. So we still have about 20 of those in the hospital. But again, that number is dwindling as well. That will be the slower number to recover because, again, they're long hauls.
Is this really kind of what you expected from the trend? Is it following the pattern that was, I know at the peak of Omicron, it was expected, that this is going to fall down. Is this kind of working the way that you thought it would here within the hospital?
Yeah, one of the advantages about being in the center of the country is, we get a chance to see this activity on the coast frequently before it actually shows up here. So we saw this pattern on the coast as well, where the communities got hit really hard, and then it really fell off fast. So we did anticipate that this would happen, and we're grateful that it's fulfilled its role in rapidly going down so that we get some break for our caregivers. But it did follow the exact patterns that other communities have gone through.
How do you prepare yourself for it? I'm trying to figure out how best to say this, but we've been there, done that. We had the numbers go way down. In fact, we weren't even having to report them because I think they were under 10 or something like that, and then they spiked back up. Are there fears that's going to happen again?
Yeah, I think it's time for us to discuss the change in our language from a pandemic to an endemic. And an endemic means that you're not going to ever get rid of it completely. It's going to be at a low level in your environment forever. So flu is endemic. It is here episodically throughout the years. It never really, we don't eradicate it completely. And I would advocate, and there's actually language being forwarded in Congress to discuss changing it from a pandemic to an endemic, with the idea that we're going to see some of this smoldering in our community in the pockets that haven't been infected or vaccinated. And we're going to see this episodically with new variants, but we would, unless there's an extended period of time where our immune system kind of forgets, and then we have a new variant, I think we won't see those giant bumps, because we really are approaching herd immunity again when you take into account the number of people who've been vaccinated as well as those who've been naturally infected.
With that said, what is your advice to residents concerning this endemic, pandemic, whatever it is?
So I think realistically it's fascinating. I think we can extrapolate a lot of what's happened over the last 2 years and realize that we're probably better off in a lot of ways. So for instance, our flu numbers are much lower than they have been. Now they're not as low as last year when everybody was all masked up and really taking precautions. But we're still seeing much less flu than what we would normally see because, let's face it, people do wash their hands more. They pay attention more. I think we're more aware of the potential for infection. And so what to do? I think we just continue to be reasonable to avoid those unnecessary exposures to sick people. I think I think we have a test of reasonability. And what I mean by that is that people have figured out how to do this better. That's why our flu numbers are lower. And so if we kind of continue along and being sensible, I think we're likely to avoid major outbreaks unless, again, we get this new variant somewhere along the line that our immunity doesn't work against.
Obviously, there's been some shuffling at the top, administration-wise here at Mosaic, and you have moved into a new role as Chief Medical Officer. There'll be an interim CEO on its way. I guess, how are you working to make sure that the hospital is stabilized and that everything continues to flow?
Sure, thank you. So the core team is still here and present, and it's really unchanged. And so realistically speaking, we are waiting for Mike Poore. He starts on March 14th. He's our new interim CEO, and the search for a CEO continues and is ongoing already. So we have multiple candidates who have already expressed interest, and so that is an active process that the board is looking at. From an internal working aspects from the operations, we have an excellent operations team. The team that did all the preparation, the people who are really responsible for running the trains on time and for making sure that we have our COVID procedures and processes in place, they're all still here and they're all still functioning, so it's really been seamless.
What qualities are you looking for the CEO as the search starts up?
Sure. The board has done an extensive job. They've hired a search firm, to help us with that interim search, and they have delineated those qualities, and so they interviewed from board members all the way through frontline staff as to what they saw to be what they request to be the best characteristics for a CEO. So I would have to defer that question to the board, but it has been extensively, but prior to the search beginning, the board took the opportunity to really delve into all levels of the organization and say, what are you looking for in your next CEO?
Have you applied?
I'll defer that question.
One thing that you were discussing, herd immunity has been a topic for a long time now, considering we've been through this for 2 years. But as you look at our community, though, the vaccination numbers, the number of places who are still enforcing masking, changes within schools, and also people in general who are still contracting the virus or the variants, how do you suppose, though, that we could even reach herd immunity even by, when you think about the months coming, summertime, people will be gone out of town, travel will probably pick up. How do you expect that this community, just here locally, even in the middle of the country in St. Joe, can actually expect to see herd immunity even in the next few months?
Well, hopefully we've almost got there. Omicron was unbelievably infectious and fast, and fortunately not very severe compared to previous strains. It definitely caused some death and destruction, but it really was much less severe. That being said, when you look at our positivity rate of how many people became positive, we had 1 week of 2,000 positives inside of our community. Again, when I talk about that, I'm talking about our 5-county service area. So we had 2,000 positives in one week. That was 4 times higher than any previous wave ever had. Now that is in the setting also of the fact that the previous waves, we were the only ones testing, us in the health department. Now there's home tests. Walgreens, Walmart, CVS is testing, the health department, us, National Guard ran tests. There was lots of other venues that aren't even incorporated in that 2,000. So again, we have to be substantially closer to herd immunity. And I'm hesitant to say we are at herd immunity. I'm hopeful. But when you look at the numbers, again, this really accelerated us towards herd immunity. Go ahead.
I'm sorry. Obviously, you stressed that the Omicron variant was still, had a significant impact. But can you see some of the, positives or the silver linings behind the Omicron variant that maybe for the vaccinated and the unvaccinated provided a layer of protection that didn't exist before that?
Yeah, this is certainly as I like to say, it vaccinated the unvaccinated. So you got the natural immunity aspect, which is very valid and very real. And that's part of, I am definitely pro-vaccination. On the same token, the other way you get there is through actually contracting a virus or the infection and getting natural immunity. So what we did is we accelerated that course. Omicron was probably exactly what we needed. It infected people, but it wasn't nearly as destructive. I'm thankful that it was Omicron rather than Delta, which was far more destructive, the wild strain, the first strain. Those were far more lethal. And so, again, Omicron in its own way may have done us a bit of a favor as it burns out these pockets of potential sources for it to infect. So that's the concept of herd immunity, is if we can get the pockets burned out where the virus has nowhere to go, it dies off.
Where are we in staffing? I know staffing's always been a concern, the hours worked, the strain and the stress. Where are we on staffing?
Yeah, staffing has really been the biggest challenge to this. We've gotten over the supply hurdle. We were very adept within Mosaic at getting our supplies, our medications up front. So we've actually not suffered in the supply chain. The difficulty has been in the care of these individuals because, again, if you remember from some of our previous conversations, it takes more people to care for a COVID patient than it does other patients. And so where we would normally have a nurse on a 4-to-1 ratio, 4 patients to 1 nurse, COVID requires at most you have to be 2-to-1. So basically it takes 2 nurses to take care of 4 people instead of 1. That magnified the shortages across the country with regards to staffing. We've been subject to that as well. We've done better because we have dedicated caregivers who have stuck with us, who have put the extra time in and have done the extra shifts. They've stepped up when we needed them to. They worked many days in a row. And again, this has been a long haul. We haven't seen this low of a positivity rate since October. That was 1 week. And prior to that, it was June of last year that we saw this positivity rate. So yes, we've seen some staffing shortages. We've had to hire some agency nurses. So we're in the process of decreasing that agency staff and getting back. But again, we're seeing our census go down, which is great. That gives some break and some time to build some resilience for our caregivers.